All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also chiropractic physician at Gates Brain Health. Today I'm talking about concussions and SPECT scans. And that is what we're going through. A lot of you have heard about SPECT scans. There's one very famous clinic, group of clinics, across the country that use SPECT scans for a wide variety of neurological and psychiatric disorders, and so many of you have had a SPECT scan, and I get questions frequently about this in terms of the accuracy and do I do SPECT scans, and so I'm going to go through all of that. So that's the story. So this is a really nice article. I think it's from Neuroimaging Behaviors. I'd have to remember Neuroimaging Clinics North America. I think it was 2018. Yeah. And so PET refers to positron emission tomography, and single photon emission computed tomography. So that's SPECT in brain concussion. And so they basically do this really nice overview of it, what it is, how it works, and its utility, and is it better than CT scans and MRI scans. Many of you who have had concussions, you go to the emergency room, they do a CT scan, oftentimes it's normal. Or you may have persistent symptoms, and then your doctor says, well, let's get an MRI just to make sure you don't have some persistent bleed, and lots of times those are normal. And these normal imaging modalities many times pose a significant problem to the patient who has post-concussion syndrome or post-concussive symptoms, because this person otherwise looks normal, but they don't feel normal. They're not how they used to be. They can't think how they used to be. Their memory is off. They're fatigued. They may be depressed. They may be anxious. And so as time goes on, the more and more windows that we can get to document why these individuals have something going on, the better. And SPECT is certainly better than your standard CT and MRIs from a functional standpoint. When we do a CT scan, I should have attached some images, or an MRI, you're looking at basically the brain from a macrostructural point of view. You're looking for tumors that are growing in there. You're looking for signs of stroke. You're looking for bleeds, as an example, relative to head injuries. Those are relatively large. When we're talking about the effects of a concussion or a mild traumatic brain injury, the effects lots of times are microstructural. And so they may be changes in blood flow, and that's where something like SPECT comes into play. So this is a picture of a SPECT scan, and this is from that same article I was quoting. And they, in essence, are representing here that most studies find, I think it's like 94% of studies published by 2014 found some reduction in blood flow in the frontal lobe. So you can see here, I'll use the mouse. That's looking at the frontal lobes. Here you're looking at the frontal lobes basically, I believe, from the top, and here you're looking at the frontal lobes from the bottom. And they're saying that 94% of studies are showing reductions in blood flow in the frontal lobes after head injuries. Kind of cool. And then you can see other areas of the brain, like the temporal lobe, 76%, 71% in the parietal lobes. So that's pretty cool. Because again, your standard imaging is not going to really show anything, and then here we have the SPECT scans that are documenting, hey, there's a difference in blood flow in your brain, and that can be very important in terms of symptoms. There's something called neurovascular uncoupling, where after patients have brain injuries, they don't get enough blood flow to different parts of their brain that they are utilizing. Think of a muscle. If you're doing a bicep curl, let's say with a light weight 30 times, you want to get blood flow to that bicep to pump out things like lactic acid. Well, the same thing with your brain. As I mentioned so many times, your brain is, if I can get the brain, your brain is 2% of your body weight, but it consumes 20% of the oxygen. So we need a lot of blood flow and oxygen going to the structure. So if you're thinking, you're trying to pay attention, you're trying to learn something, you've had a traumatic brain injury, and you're not able to do what you used to do, it may be in large part because you're not getting enough blood to that part of your brain. So that's where SPECT scans are so important. So I just put this in here because there are disclosures. Anytime a study is published, we need to look at, what the confounding variables may be, conflicts of interest, and so they disclose that here. And one of the authors, I think, owns a group of imaging companies, but that's fine. It is what it is. You conclude, but I think that's fine because he's trying to advance himself. So nonetheless, here the physics of SPECT scans. So SPECT is very similar to CT. What is a CT? A CT is a very high-powered X-ray. And what is an X-ray? An X-ray is basically where you put radiation through a part of the body, and when there's resistance to that radiation, then you're going to get a different shadow, so to speak, based on the thickness of certain tissues. So when, for example, chiropractors were the first doctors in North America to take an X-ray of the spine, believe it or not. So they were very much into diagnosis, and still are, but they were the first ones to take an X-ray of the spine. And what that really looks like is it's a shadow of what's going on in the spine. So your vertebrae are very dense, and so when you put radiation into that vertebra, it's going to basically create a different image than your soft tissues, which are not as dense. And so SPECT scanning takes that same principle of CT, which is way more powerful than an X-ray, and then it combines it with what's referred to as scintillography or scintillation. Scintillation refers to when you have something that is going to kind of like fluoresce. It's going to light up. And so with a SPECT scan, the doctors or the radiologists inject some sort of contrast agent, basically. They're radionuclides. And it could be technetium-99, thallium-201, iodine-123, iodine-125. There's a bunch of other ones that they even use for the brain, but that's the general premise. So now they inject this radionuclide, and I always want to call them radionucleotides, but the radionuclides into the body, and then you have a special camera to look for the radionuclides. And so along with the CT scans. So from that, SPECT scans have become the gold standard for estimating regional cerebral blood flow, or how much blood you're getting to a different part of your brain. Functional MRI, for those of you who are aware of it, also does the same thing, but with functional MRI, there has to be a lot more extrapolation of the data afterwards than with SPECT scans. So that's kind of nuanced, but I always like to talk about what it is and give you guys some information. So here, highlighted, SPECT scanning is the most enduring and the most widely available technology for measuring brain function. SPECT facilities outnumber PET facilities 12-fold. So PET, like I talked about, is positron emission tomography. Lots of times people get PET scans if they're concerned about metastatic spread of a cancer. But with SPECT, here they're saying it's the most enduring and most widely available technology for measuring brain function. Why is that? Because a lot of radiology facilities have SPECT scanners. When I go in and I talk about diffusion tensor imaging, I am a huge fan of volumetric MRI and diffusion tensor imaging for the purpose of documenting brain injuries as well as long-lasting effects of not only brain injuries, but it could be depression and anxiety, because you're actually seeing changes in brain architecture. But not a lot of facilities have that, whereas most facilities have SPECT scanners. So that's where SPECT scans can be widely used to say, hey, you've had a traumatic brain injury. Let's look and see, do you have changes in cerebral blood flow in different areas as a baseline? And you see down here, regional cerebral blood flow is a valid marker for neuronal activity over most of the physiological range of cerebral blood flow. Now, what's cool is that they have shown that if you have an abnormality in regional cerebral blood flow after a head injury, there's something like, these studies have shown a sensitivity of 100%, specificity of 85% for predicting persistent neuropsychological deficits at 12 months. So that's really important. So for anyone who's looking to document a head injury has happened and this head injury can have long-lasting consequences or sequelae, then a SPECT scan can be a benefit, especially since a lot of people have them. So that's where SPECT scanning is good. So I never want to come off like SPECT scanning isn't great. It's just from an architectural standpoint, I think that diffusion tensor imaging and volumetric MRI is better, but I'll go into that in a later broadcast. Again, as I mentioned, the frontal lobes are most commonly identified. And here's a really cool picture. This is from a study where they were basically doing a certain type of laser to the brain. It was transcranial, so through the skull, and they basically showed that before treatment, this is what it looks like, and after treatment, it looks like this. Now, these colorful reproductions of the brain look so cool to the lay person. Even if you look into biofeedback, neurofeedback, quantitative EEG, they create similar pictures of the brain. It's very visually impressive, or very visually impressive. And so that part is cool. And so lots of times this resonates with patients because they can, anytime you can see your brain, it's a good thing. And so you're looking at your brain saying, wow, look at that. Wow, look at these quote unquote holes where there's not enough blood flow and things of that nature. That helps people to understand maybe that it's not them, it's not a personality weakness, that there is a neurological issue reinforcing why they don't feel normal. So I'm all about that. But again, you're looking at blood flow. Can some blood flow parameters change? Yeah. So anyways, it's good. It's not my favorite, but it's good. It is better than just a CT or standard MRI for a head injury. So that's my take on SPECT scans. So let me know your thoughts. And yeah, so very cool. And I think that's pretty much it. So I hope you all have a lovely Saturday, and we'll go from there. Okay, let me see here. We'll expand that. And